Good day, my name is Glendeline Dangan, a first-year nursing student at Central Mindanao University. In this video, I will be assisting a patient with ambulation using cane. So now let's start. So the first step that we have to do is we have to review the medical record and nursing plan of care for conditions that may influence the patient's ability to move and ambulate. Assess the tubes, IV lines, incisions, or equipment that may alter the procedure for ambulation. So I will now check the medical record of the patient. Okay. So review of the medical record and plan of care validates the correct patient and correct procedure. Identification of equipment and limitations helps reduce the risk for an injury. The second step that we have to do is to perform hand hygiene and to put on PPE as indicated. So that is done to prevent the spread of microorganisms. So I will be using this alcohol-based hand rub to perform the hand hygiene. So the next step that we have to do is we have to identify the patient. Explain the procedure to the patient. Tell the patient to report any feelings of dizziness, weakness, or shortness of breath while walking. Decide how far to walk. So patient identification validates the correct patient and correct procedure. Discussion and explanation helps the nurses to gain the patient's trust and also his cooperation. Now let's identify the patient. So, good day, sir. I will be your nurse for today. Ano sa iyong pangalan, sir?
Michael Puas.
Kano sa iyong birthday, sir?
November 28, 2001.
Okay, sir. Thank you. So, for today, sir, I will be assisting you to ambulate. So, using a cane. So, okay lang, sir?
Yes.
Okay, sir. If ever, sir, makafeel ka o pagkalipong, kung kanang maglakaw-lakaw ka, sir, or any pain or any discomfort na yung ma-feel, sir, imo lang din i-report sa ako, sir, ha?
Okay.
Okay, thank you, sir. So, now let's proceed to the next step. So, encourage the patient to make use of the stand assist aid, either freestanding or attached to the side of the bed if available, to move and sit on the side of the bed. So that encourages independence and also reduces strain for staff and decreases the risk of injury to the patient. Now, that is followed by wrapping the gait belt around the patient's waist based on assessed need and facility policy. Gait belts improve the caregiver's grasp, reducing the risk of musculoskeletal injuries to staff and the patient, and provide firmer grasp for the caregiver if patients should lose his or her balance. So, sir, tabangan ta ka sa pagbangon, sir, ha? So, ano na, sir? Ano ko imong tilde, sir? And then, tabangan ta ka sa pagbangon, sir. Gunit na lang ka diri, sir, oh. Kaya para makapaan ka, sir. In 1, 2, 3. And then, para sa imong pagtindog, sir, ako kang tabangan sa pagtindog, pinaagi aning gait belt. Okay, so tindog ka, sir, ha? In the count of 3. 1, 2, 3. Okay? Next, we have to encourage the patient to make use of the stand assist device to stand with weight evenly distributed between the feet and the cane. A stand assist device reduces strain for caregiver and decreases risk for patient injury. Evenly distributed weight provides a broad base of support and balance. So I'll be getting the cane. And then asa man mo hang mas Tapos, kusgan na side, sir. Muhang
Right.
right. Okay, so, dire ni sir. Then, okay. Next, tell the patient, I have the patient hold the cane on his or her stronger side, which is what we did earlier. While the nurse stands to the side and slightly behind the patient. Holding the cane on the stronger side helps to distribute the patient's weight away from the involved side and prevents leaning. Positioning to the side and slightly behind the patient encourages the patient to stand and walk erect. It also places the nurse in a safe position if the patient should lose his or her balance or begin to fall. So that is followed by telling the patient to advance the cane 4 to 12 inches, 10 to that is 10 to 30 centimeter. And then, while on the stronger leg and the cane, advance the weaker foot forward parallel with the cane. Moving in this manner provides support rather and balance. Okay, so asa man taon na sir? Dito lang taon na sir. Sige. So, ang una ni mga step, sir, ha? Kay ani. Okay, una ni mga sungkod. Dayon ang katulong isang tail. Okay. Okay. Ito, sir. Laar na nalik mo, sir? While supporting his or her weight on the weaker leg and the cane, have the patient advance the stronger leg forward ahead of the cane, heel slightly beyond the tip of the cane. Moving in this manner provides support and balance also. So, try daw, sir, if iuna ni mo og step ang imuhang stronger nga tiil, sir, kani. Ay, mali, sir. Ay, tam. And then, sabay ni og kani. Okay. Halo lang, sir. Okay, balik lang, sir. Next, tell the patient to move the weaker leg forward until it is even with the stronger leg and then advance the cane again. This motion provides support and balance. Okay, so, una na po naman ito, sir. Same na sa kanina nga process. Sige, una na mga sungkod. And then, stronger ni mga leg. Okay, good. And then next, continue with ambulation for the planned distance and time. Return the patient to the bed or chair based on the patient's tolerance and condition, ensuring the patient's comfort. Make sure call bell and other necessary items are within easy reach. So, continued ambulation promotes activity. Adhering to the planned distance and patient's tolerance prevents the patient from becoming fatigued. Okay, sir. Sige, padulong mo dayon sa imong bed, sir. Okay, good. Sige, sir. Tara, pasapanin ko, sir. In 1, 2, 3. Good. And now, let us proceed to the last step, which is to clean, transfer aid per facility policy. If not indicated for single patient use, remove PPE if used, perform hand hygiene. Proper cleaning of equipment between patient use prevents the spread of microorganisms. Removing PPE properly reduces the risk for infection, transmission, and contaminated of other items. Hand hygiene prevents the spread of microorganisms. So I'll be using this alcohol-based hand rub. And that's the end of this procedure. Thank you so much for watching.